Thank you, everyone. I'm Angel Colao. I'm co-founder and CEO of Aritium. So we are a startup founded in 2021. So we are mainly focused on developing and deploying IoT solutions in the hospitals and healthcare organizations market. No? So from my side, I have been working for more than 10 years on projects in healthcare, trying to help hospitals and healthcare organizations to leverage IT solutions to optimize how they work, mainly projects related with electronic health records, integration of different systems, and so on. And during the last years that I have been working on IoT projects, and especially with LoRaWAN, so I really think that LoRaWAN has some special elements that make it a really good fit to massively adopt IoT in the healthcare and hospitals environment. No? So just to start around this idea of the smart hospital. No? So, this is a definition from a publication, the Smart Hospital White Book, a publication made in Spain in 2020. So I was part of the group that was working during several workshops around what could be a smart hospital, and especially what are the challenges of hospitals and healthcare organizations, and how technology could help to overcome them. No? So basically, at the end, the idea of this smart hospital is a hospital that really leverages technology to do what they are already doing, to do that better, and also to do additional things. No? Especially in this part, it's like to be able to provide services beyond the hospital walls. No? And also from the definition and from all the analysis that we did in that work, so it's clear that technologies like IoT and AI, once you have the data, all the analysis of the data is like the two key technological elements that can really transform how hospitals and healthcare organizations operate all over the world. No? This picture is the Mayo Clinic in the US, that at the end is like one of the reference. No? In the last publication by Newsweek was ranked as the smartest hospital in the world. No? How IoT can make a hospital smarter. So it's here interesting to take into account the quadruple aim. No? This is a framework from the Institute for Healthcare Improvement that at the end all the healthcare systems, for extension, hospitals and clinics and so on. So they try to cover 4 different objectives. No? For one hand, provide better health outcomes, so to improve the healthcare of the people they serve. Lower the cost of care, so to do so efficiently. Improve patient experience, so at the end, once the patient goes there, so that the things are smooth, that there are not waiting lists and so on. And then, this was an addition in the last years, the improved patient staff experience. No? So the levels of clinicians burnout are very high now. As they are a scarce resource, so it's important to take or to do things to create a more pleasant environment. No? It's easy to understand that how IoT can have an impact on these different elements. Just following what Roman has just said, in terms of staff experience, so it's incredible how many administrative manual tasks nurses and clinicians in general needs to spend. No? So we saw just a minute before a figure that 30% of the time taking vital signs. So one study in a hospital in Switzerland says that more than two-thirds of the time are spent on tasks that are not directly related with being in contact with patients. No? So there are a lot of stuff that prevent them to do what they do best, at the end is taking care of the patients. And there is a lot of potential of optimizing, to automate different processes there to allow them to do that. Why IoT, having clear that it seems that you can do things using this technology, but why it didn't be adopted, sorry. So, basically we have faced some limitations, no? Well, this is a raw evaluation just to have something that is easy to share. But basically, if we take into account the coverage, the range of the communication and the battery consumption, so, well, for sure, initially all the initiatives were trying to leverage already available technologies like Bluetooth, like Wi-Fi, like LTE, where you have some pretty relevant limitations, especially in battery consumption for Wi-Fi and LTE, or in terms of coverage for Bluetooth. Then we have all the LP1 technologies that we solve these problems around the coverage or the range of the communication and also the battery. But we have a problem with the flexibility of the architecture. So let's say that typically why we have failed, and I include myself, on deploying IoT solutions in the hospitals is, and especially in Europe is pretty relevant, maybe US is a more open market for cloud solutions, is that the hospitals, they are reluctant to deploy cloud-based solutions. So they really want to have control of the data, and even when they are embracing private cloud, but they still are not relying on public clouds. No? So basically, for all these technologies, you always need to send the data to a third-party platform and then try to integrate it into the hospital systems. No? And this is exactly the point where LoRaWAN, as an open standard, with an open architecture, allows you to play with this architecture. No? Let's say that, well, for some applications, it's very easy to deploy a cloud-based application with the data flowing to a public cloud. But for some specific use cases, it's pretty relevant if you are able to provide an on-premise architecture, or at least, and it's what we are trying to do in Aritium, at least a hybrid architecture. So what we are trying to do, and it's a little bit what we can see in this schema, is at the end, as you can play with the architecture of LoRaWAN, so we are deploying a piece of software on-premise, that is what we call here the Aritium Hospital Hub. At the end, it's a piece of software that allows any hospital to be IoT ready, let's say. No? So we can create, in this case, a private LoRaWAN network, so that at the end allow us to deploy different sensors, different devices. So we are also trying to leverage the doctor device to do some pilots in hospitals, try to automate all the vital signs register. And this element can also make a translation to the health IT standards, like, for example, HL7. It can provide also FHIR APIs, OpenEHR APIs, all the different stack of standards that are managed and directly understood by hospital information system, electronic medical records, and so on. But at the same time, it allows you to keep the cloud-based solutions, so you can leverage all the agility, all the scalability that the cloud platform can provide you, in terms of having all the anonymized data, all the dashboards where you do your AI analysis, you develop your machine learning algorithms, and so on. And basically, this is the reason why I really see that LoRaWAN could change the adoption of IoT in the hospital and healthcare organization environment. We are currently working on different use cases, so this is a little bit some of the main use cases that we are trying to cover. So from the task control, it is at the end trying to optimize task. In this case, we are working with a hospital in the emergency department to optimize the cleaning process of the boxes in the emergency department. So once the box is ready to be cleaned because the patient has left, the nurse press a button so the cleaning service can know that they need to clean the box 22 or whatever, and then they can notify that the box is already cleaned. We have also solutions to monitor indoor air quality, very relevant now in COVID times, to monitor temperature of vaccines, medications, all the sensible materials that are stored in fridges in the hospitals almost anywhere and without good supervision nowadays. Then we are trying also to combine LoRa with Bluetooth to provide indoor location for seniors in elderly care centers, but also for mobile assets in the hospital. And then we are working on 2 more clinical-oriented use cases, one to monitor medical oxygen consumption and also trying to assure the traceability to this treatment to the patients. At the end, is trying to leverage a flow meter, that is the device that is attached to the wall to regulate the administration of medical oxygen to patients. So also we can provide this data to the hospital information systems so they can make the link between the treatment and the patient. No? And, well, the trying to leverage wearable devices also to automate the registry of medical science. No? Basically, that was a little bit what I wanted to share with you. For us at the end, it's clear that hospitals and healthcare organizations need to transform. So the challenges, we saw previously some figures, so the challenges that they are facing are huge. So they need to see how they can become smarter. IoT is a key element on this transformation. And it seems that LoRaWAN can be a game changer because it provides some very differential elements like this, especially this flexible architecture. So it can make, IoT be really massively adopted. No? So now the time for a change in healthcare is now. The technology is ready, so we are ready. So let's do it. So thank you very much.